group A Streptococcus infection that is all over the news. Essentially, I think you're right. 15 people so far. Olufowobi, group A Streptococcus. So I think that's why it's important that we talk about this topic, so that one, for us to understand what it's all about, then two, for us to see that there's really no cause for alarm. Only 15 people, at least over the last few months. Just to put things into context, again, not trying to tribalize Totiku. In Nigeria, we have 95,000 children under 5 that dies of malaria every year, as at last year. That will give us about 200 children per day. So 200 children per day, this is a trouble. So, but, again, it's just to put things into context for us. Yes, 15 people is a lot. One is so many, but I think there are things we can do about the group A Streptococcus. Is a condition or is a disease that so it's not like it's new. It's not like COVID or anything by everybody do GG. It's a bacteria that we always have at this time of the year, especially this period of the year, but not usually at this high number. So hence the worry, okay, there's a growing number. I think the statistic shows that last year, 4 children local. So you put that into context, okay, 15 is times 3 or almost times 4, and we are still counting of our T. Olufowobi, group A Streptococcus. So again, with regards to the condition, I'll try and spend 10 minutes so that I'll give 10 minutes for questions and answers if there are any. So with regards to the condition, it is a bacteria that affects usually children, usually between the ages of 1 and 9, or it can affect older kids and even younger kids. The common symptoms are fever, and we'll understand the fever is literally common for almost all conditions. So common conditions are fever. So Taramo Batimbono record 39, 40 degrees. So I would employ every parent at least have a thermometer in your house. Taramo Batimbono Kawo, Kinshipe Kama forward pipe around, measure it so that you can put it into perspective. How high is high, So fever, usually the fever doesn't tend to respond to normal paracetamol, ibuprofen, persistent fever. The other thing is sore throats. So some children will be able to complain if they money sore throats. Obviously, I want to sorrow. But some children will not be able to complain if they are on sore throats. So one thing you will notice is magba solid. So omi, be liquid magba. So that might be an indication. Okay, you might want to have a look. I might repair mama call too solid. Then I confirm more liquid alone. So that's one of the things, especially on Moto Bali Express, I'm having a sore throat or things like that. The other thing is that it's rash. So the rash is relatively common, a common symptom of group A Streptococcus. Typically, rash group A Streptococcus, feel be sandpaper. Sandpaper, carpenter man. So Boshima high on lower yen, about for rash, that sort of feeling. So it gives you an indication like, okay, this is probably gas, a streptococcus sort of rash. Like I said, it's a bacteria. There are so many theories that have been postulated why the sudden surge. People say the pandemic. Generally speaking, when children or when we're exposed to bacteria, the body learns from it and develops a protective mechanism against it. So in the last 2 or 3 years, starting the Monday, they did have opportunity to be exposed to this bacteria. So now everything to Chile, it sort of caused the surge. Again, that it's a postulation as what is the probably cause. Then generally speaking, you have other symptoms like generalized body pain, lethargy, and things like that. You know, and things like that. So those are usually the symptoms. The bug itself can also, it can be found normally in the body, in the throat, and it can be found normally in the body. But when it gets to areas that it shouldn't get to, like the blood and things like that, that's when it causes an infection. Then some children, their immunity is not as good, but you're on your other comorbidities, other kidney or don't suppress the immune system and things like that. So the way that every child will respond to it is totally different. So Kawa more cautious about these symptoms. About a repair, okay, or more improve. Paracetamol 1 day, 2 days will improve. The earlier you see your GP, there's a 111 service. There's the out of hours GP, a very normal GP, to contact, so that, because the earlier we start treatment with this condition, the better. It reduces the chances of it or get worse. So I think that's usually about the symptoms, as it were. Then in terms of prevention is generally, well, before I go into prevention, another thing that I must mention is usually we know that it tends to follow flu virus. So the child might start with normal flu, then develop, gas infection on top of it. So, you have stories like, the fever has persisted for 10 days or for some number of days, kowale and things like that. Or the child got slightly better, then again, sort of thing. So that's something we should also keep at the back of our mind. In terms of the prevention or route of transmission, usually even by contact, touching, kissing, all those sorts of things, poor hygiene, sort of things would, can lead to spread of contact from one person to another. And then, okay, being that our model that is more common in children, ọmọdé wa fi tọ́ ìṣeré ní class, ẹlẹ́lẹ́ ìkúmú àṣesí, ìtọ́ àṣesí, àpẹsẹ̀ sí ọ̀rẹ́, all those sorts of things. So it's almost, we will try our best in terms of prevention, but you can see how easily it will spread within a school environment, where there are so many children that they really can't, caution themselves in terms of how they mix and how they relate to one another. So generally speaking, hand washing, talk more about it at school, can make sure we can for, and I think it's even part of the sunnah that when you come back from outside, wash your hands as well. So our religion has taught us these things as well. The one thing that I must mention to come on, alo toilet roll, atún kì sínú àárín toilet roll, afi fukumu, and then atún kì sí the middle kidney. So what you're doing is you're putting the bug back into the hole of the toilet roll. And then your toilet roll, those sort of practices are not good. You sneeze, you go and wash your hands, you blow your nose, you throw it in the toilet and you flush it and things like that. So those things would hopefully help to reduce how the spread, sneezing, and all of that would help to reduce the spread of gas infection. So usually it's not a condition that usually would lead to death. But again, like I said, yes, we are seeing an increased number, but I think the main issue or the main focus is, let's be aware. We have any symptoms that it's not normal, or is persisting, or the child is not improving, then see your GP as soon as possible. Some of the other symptoms that I think I forgot to mention is, apart from the rash, they also sometimes have flushed cheeks. But like our dudu, you might not actually see the flushness on like our people, that you easily see that flushed cheeks. Then in some cases, the strawberry. Me, it will be swollen with strawberry, like strawberry, right? Look normal, that sort of thing. Those are other subtle signs. It's not always all the time, but those are other things that we might also look for with regards to the gas. So I think, generally speaking, that's, to summarize it, it's something we've always known. Luckily, the studies have shown that the particular strain is not as if it's more virulent than it got at more. It's just, the fact that, yes, the deaths are happening, unfortunately, and there's treatment for it. Treatment for it is antibiotics, penicillin. People who are allergic to penicillin, there are alternative antibiotics that your doctor can use. It's very, very treatable, but even if you happen, if our children happen to have it, and even on antibiotics, then still see your doctor. So if you're a matter of faith, improve. So if you're not seeing that improvement 48 hours, 72 hours down the line, then you need to still go back and say, I'm not seeing improvement in this child. Maternal instinct is very, very important. Mothers who know there's something wrong. Fathers may not really be very, but mothers will tell you, that there's something wrong. I know my child. This is not my child, sort of thing. So those are the things I think we should know about. Not to worry too much about it, but again, more of be vigilant with regards to the gas infection. So I don't know. I think I'll probably stop here in terms of, I think that's the overview. Then if there are any questions, concerns that anybody has in the address in the few minutes, the affiliate you want to ask any other person? Yeah.
Notice strange thing, most of the symptoms is always the one I'm concerned about. How soon can someone see the rashes? I look at the movement system and look at the photo. It might be the last stage, the rashes to my head. It might be the register the economy. So how soon can you? Because my probably thinking, okay, so it's normal food, so it's not having rashes, or so maybe not putting that in food. So maybe the rashes might come up later on. So how soon can you get that rashes?
Okay,
so other symptoms look like normal thing to me, and that of tongue as well. Those are the major ones, the tongues and the rashes.
So I don't think we should fall into the trap of expecting to see all the symptoms. So you might not have all the symptoms in all the children. Commonly, you have that fever and sore throat. Commonly, the rash plus or minus 48 hours around the onset of fever, but you might not necessarily happen. So kama with Tatori Bubo, not all the children will manifest. Will have all the symptoms. So your child has had a flu-like symptoms, runny nose, catarrh, cold, Few days later, Oberesinini, sore throat, and all of that. That is enough suspicion. That is enough suspicion to make you know that, let me see my doctor. Persistent fever, usually around 1 day, 2 days, paracetamol, re-improvement. Tí wọn bá fún paracetamol, tí wọn re-improvement, tó yín deteriorate, please early speak to. Don't try to diagnose it. Don't try to say this is cold. This is not cold. Sorry, me tea rash. Me tea. I went to that. You have a child, because that's the whole essence of creating the awareness. You have a child, 24 hours, 48 hours, not improving, it's deteriorating, then get somebody to see the child. Our role is not to start saying this is probably a cold, and Toriko this all these other symptoms. You have any concerns whatsoever, then speak to somebody.
Probably when we notice all this, we should try to check the temperature if it's above 39, and that's why doctor said it's aggressive for all of us to have thermometer.
Usually 37.5, 6, 7, 8, probably most likely a viral thing. But again, I would rather say you have concerns, speak to somebody. You have concerns, speak to somebody. Because we know our children. We know when we are worried, we are worried enough to be worried, if I put it that way. Speak to somebody, but because you just know your child. So come on, try that then definitely it's probably not gas. Yeah. I hope the children understand, because I was speaking a bit of Yoruba techniques.
Do you understand?
You understand?
But is there any question you want to ask? You want to ask any question?
You try with some antibiotics. Yeah, that's it. Yeah, usually. After once it's confirmed scarlet fever, you tend to tell the child to isolate for some days from going to school, because like I said, only spread the process so you tend to isolate the child before going back to school. But antibiotics would usually help. So when you have it, you become unwell, you have a temperature, you feel, you sometimes they have body pains, they have a sore throat, then those sort of symptoms that would make mommy or daddy to think, okay, could this be something more serious? So you have anything you're concerned about, let mommy and daddy know. Yeah?
I think that's it. Thank you very much.
Okay, thank you very much.
So thank you very much to our doctor. He's very busy. He's supposed to be at work. But he said he will call immediately after 3, so at least he can be with us for 20 minutes by 3 o'clock. Alhamdulillah, we are on schedule. So the time is perfect. We thank our doctor. May Allah subhanahu wa ta'ala continue to increase in knowledge and wisdom, and continue to guide him, inshallah. So may all our children continue to live long. We all want to live a good life in good health. The last one of our ta'ala grant us good health and grant us elongated life, inshallah. And we pray for those who have lost their life. May Allah subhanahu wa ta'ala accept their returns. And those that are in the hospital, may Allah subhanahu wa ta'ala grant them full healing, inshallah. So we thought this is happening, and this is what we need to. Children, you can go back to your classes. So this is what we need to sensitize our members to know about this new, like doctor said, it's not new, but because it seems like a surge. When you have like four people affected last year, and now it just started, code has just started, and we're already recording 15. So that means it's likely to be more than expected this year. So, and this is why the British Medical Doctors Association in UK, the Muslim British Medical Doctor Association in UK decided to, volunteer and go to every mosque to educate their members. So for those of us that were not present today in our Salah, if we have friends among them, let us teach them again. Rasulullah said, the best among you is the one who learns, even if it is one letter, and teach others. So our girl is taking Ali Koyo. The only thing I will not be able to pronounce is the Streptococcal. Do you have any question? Okay, so Streptococcal, I want to go fast in the pronunciation. So, but when they make it more simpler, okay, the gas. So it's called gas. So gas, is the formulation we call up that for. Oh, come on, fresh or Allah Nabi Ladon, La ilaha illallah, Wala Muhammad Rasulullah, La hawla wa la quwwata illa billah. Because we have our organization of Salawat, we started last week, and today we intend to do